Adult Day Healthcare means a productive, stimulating environment for older adults with physical and cognitive impairments, as well as respite for caregivers. Fortunately, Pensacola is home to the only licensed adult day healthcare center of its kind in the area. Here to talk with us about positive outcomes and the facility is Center Director Sandy Helftree. Sandy, thanks for being here.
Thank you for the opportunity.
Well, we always hear that it's the best kept secret or the hidden gem of the community is the fact that we do have a facility like the one that you run here, and just thanks for all that you do. Well, tell us a little bit about the facility and about that licensing process and kind of get us set up here.
Well, like you mentioned, we are the only licensed daycare health facility in this area. We're licensed by the state of Florida, by ACA, the Administration for Healthcare. We have a license currently for 52 clients per day. Our average census right now is currently 28 to 29 clients a day, but we can hold up to 52 a day. Our facility is a beautiful 2,500 square foot facility. We have 2 large rooms. Each room has tables where the clients have their meals, perform activities, and then in each room we have a sitting area like a living room. We try to keep it like a home environment. We have floral couches, recliners, TV, VCR, rocking chairs. It's just a home away from home. It's a wonderful facility. We have a relaxation room which has lava lamps and bubble tubes, fiber optics that change colors, projection of color on the wall, aromatherapy, soft music, and we use that relaxation room for when the Alzheimer clients, dementia clients, when they get agitated in the afternoon especially, we see that we can take them in that relaxation room, 15 or 20 minutes of that distraction, that soft music, soft lighting, they're ready to go back and be with the crowd again. We also have a screened-in back porch. It's beautiful out there. We have plants, flowers. Right now we have cucumbers and tomatoes. We're fenced in, locked in, so the wanderers can pace in the backyard. No one can exit. It's a wonderful facility.
Well, it sure is. It's great. And it's always fun to go over there. The people are so friendly and so nice. Well, you mentioned some of the type of clients who may come. Who does this actually serve as far as the attendees and, of course, also the families as well? But tell us a little bit about the profile of the typical attendee, if you don't mind.
We generally serve clients over the age of 60. However, we had some clients in their 50s. We serve people with physical impairments. That would be such as they had a history of a stroke, diabetics, hypertension, heart disease. And we serve those with cognitive impairments, such as all types of dementia and Alzheimer's disease.
Now tell us a little bit about your hours and how this does serve the family members as well and what it enables them to do.
The facility is located at 875 Roy Street. Our hours are Monday through Friday, 7:30 a.m. to 5:30 p.m. We chose those hours so that enables caregivers. Many of them are still working in their careers. They're busy in the community. So they can drop off mom or dad, go to their employment, work for the day, get off at 5, come pick up mom or dad. Mom and dad had a fun-filled day with their peers. Hopefully they're tired, they'll rest better that evening, and the caregivers can continue in the community.
Well, it's good, you know, if they want to continue to care for that person and not, you know, have them in another type of facility, they can actually spend the day with y'all and then go home with the family at night. What do you hear from the families as far as their feedback?
The positive outcomes, it's twofold. One for the clients and one for the caregivers, like we just talked about. The clients, again, they're with their peers, they develop relationships, they develop friendships. It's a fun-filled day full of activities. We go on great field trips. I think they feel productive. They have a purpose. Some of them think they're going to the church hall. Some of them think they're going to school. They're going to work. They're going to volunteer. So I think they look forward to coming to daycare, and that is their purpose for the day. The flip side of that is the caregivers. It's less stress for them. For that short period of time, I think the caregivers can just relax, kind of put down their guard. Caregivers that are taking care of these Alzheimer clients at home, I think they're always on their guard. They're always wondering, did they turn on the stove and leave it on? Is the water running? Where are they? Did they exit through the front door? They always have to be watching where that client is. So to bring them to daycare where they have a safe, secure environment, the caregiver can just relax for those hours, or like I said, continue in the community with their jobs, go to their appointments without taking the client with them.
Which is a great benefit for them. So if someone is working, say for example, they may want to bring their family member Monday through Friday, but if they're a caregiver who works in the home and they just need a break on Tuesday or Wednesday, for example, is short, flexible schedules available?
Yes, we're open 7:30 to 5:30, 5 days a week. You can use the number of days that suit your need and the number of hours. You can use all 10 hours a day, or you can use a short period. Okay. And I guess a positive outcome of daycare is we're prolonging nursing home placement, preventing nursing home placement, to allow these clients to age in place, to stay at home in their familiar environment with their family.
Well, you mentioned a lot of things about the schedule. I think you mentioned something about meals and activities. Real quick, just tell us the typical daily schedule, because they are really busy. They're not just sitting around watching television.
Yes, I do believe in keeping them busy. We open at 7:30. It's kind of a quiet time from 7:30 to 9. Then we do reality orientation. 9:30 we have breakfast, a wonderful breakfast every morning. It's different. 10 o'clock we start individual projects. 10:30 is a group activity. 11:30 we walk every day. We try to get the clients outside. Even those in wheelchairs, we try to get them up, keep their mobility, ambulate them. 12 o'clock is hot lunch that's brought in from Valley Foods. We have a small nap time from 12:45 to 1:30. 1:30 every day we exercise, and they moan and groan. They do not want to exercise, but they love it. So we exercise for 30 minutes, and then again we start our afternoon activities. We have snack at 2:30. We have cooking club a couple times a week where one of the groups is assigned to the kitchen. They follow a recipe. Lots of times they like to make goodies, cakes and pies and cookies. That's our snack in the afternoon. And we also go on field trips. We try to take one field trip per week. We take 7 clients and 2 staff members. We hit all the park areas, beach areas, picnic areas. We go to Bellingrath Gardens, the zoo, the Golfarium, the Explorium, all over.
Well, that's great. Well, and it is much more than just a lot of fun, which obviously it is, but you do have trained staff. Tell us a little bit about the healthcare component and the credentialing of your staff.
Yes, we do. We have 2 LPNs on staff. They are able to administer medication. We check vital signs. We monitor weights. The LPNs, I think they quickly assess medical changes that they note in clients, cognitive changes. One of the most frequent changes we see with the seniors is UTIs, or urinary tract infections. So when we see those signs, we're able to notify the family so they can take the person to the doctor and get treatment. We have assistants, and like I said, they ambulate, we exercise, we want to keep that mobility, keep them independent. We also can administer tube feedings, oxygen.
Okay. Well, great, Cindy. We're running out of time. You and I could talk forever about all the great things that y'all do over there, but you do welcome people to call you to come tour the facility. Is that correct?
Yes, please call anytime, or you can stop in if you're in the area. But the number to call is 850-266-2503, and I'll be happy to show you daycare and speak with you.
And that invitation includes healthcare providers who may want to tell their patients and families about this as well.
Most definitely.
Okay, thank you very much, Cindy.